Of the McLean County Behavioral Health Coordinating Council to order. And we have a quorum, it appears, so I think you will do roll call. Sure. Thank you.
Amy McFarland, Angie McLaughlin,
Here.
Brian Whipperman, Carrie Hopner, Cleet Winkleman,
Here.
Colleen O'Connor,
Here.
Dave Sherrar, David Taylor, Donna Bolin,
Here.
Esteban Lozano,
Here.
Joan Hartman, Kevin McCarthy, Kristen Adams,
Here.
Lisa Thompson, Lynn Fulton, Mark Jontry, Rebecca Foley, Sonia Reese, Stephanie Barish, Susan Schaefer.
Here.
David Taylor right there.
Thank you. We will now go to 2, and that's approval of the February 2nd McLean County Behavioral Health Coordinating minutes. Do I have a motion to accept these minutes? Have a motion by Ms. Rees and a second by Mr. McCarthy. Very good, thank you. We have action items. I'm moving the action items around a bit.
Excuse
So-
me.
We need to vote. All in favor
But
of the minutes, say aye. You have a, Ms.,
I don't remember seeing the minutes.
what's that? McCarthy?
I don't remember seeing minutes of that meeting.
From the special session?
Were those minutes not sent out?
I believe they were.
Were they with the packet?
Oh, no, they're not.
Then did the people who voted to or approved those minutes, were they able to read those?
They took it on good faith that they were going to show up. So no, we've not.
Then I think we probably need to back that up and move this off the agenda until everybody has those. I'm sorry, Ms. Schaefer, for moving ahead and not recognizing you. So we will, the minutes will reflect what took place, and we can approve those at a future meeting. We're going to move on to item number 3. And I'm moving these around a bit, so I want, A will be request approval of a special services request for Fuse prescriber. That will be our first one. May I have a motion to put that on the floor? I have a motion by Ms. Reese and a second by Ms. Schaefer. And discussion. Okay. Mr. McCarthy, yes. A microphone, do you not have a microphone? We need to get you to a microphone, or I think Dan will get one to you.
Thank you, sir. Good morning. Mr. McCall and I had interacted a little bit. I just wanted to confirm, is this a multi-year request? Can you shed us a little light on the nature of what we're being asked for in a little more detail?
Yeah,
Thank you.
sure. This special service request came off the back of wanting to switch our psychiatric prescriber from Genoa, and this came quite a while ago. Actually, one of the things that has further pushed this forward as something we truly want is the fact that Genoa is now a dissolved company, and so both us and the jail are looking for alternative providers. Thankfully, we were a little bit of a step ahead before that happened and had this special service request out. A contract that would come out of this proposal based on the special service request language would be 1 year in length, and we would have the ability to reevaluate after 12 months. We typically do that with any of the contracts under our department, so we have the ability to change course if needed.
Thank you.
Any other questions or comments? All in favor of the request of approval for special services for the Fuse prescriber, say aye.
Aye.
Opposed? That motion passes. We'll move
Excuse
then
me?
to request,
Just real quick, could we just have the minutes reflect that I abstained from that vote?
very good, thank you.
you.
Did you, Ms. McLaughlin? Very good. We're going to move to request approval of the Community Day Services proposal, and that will have Brian Whipperman and Mark Jontry may have some comments, but I need that on the floor. Can I have a motion for that to come to the floor? And we have McCarthy made the motion. I need a second. Taylor, thank you. And any comments or discussion? Yes,
Donna.
yes.
Well, I guess I'm kind of confused. So this is the first RFP that has come forward since I've been here. And I'm speaking from the perspective of an elected official. I know the county does things different than the city, but in general, my thoughts would be that a provider from this group would come to a meeting and do kind of a verbal presentation to get a feel from the group, and then you would request a proposal to come back, rather than the person in the group or a member of the group just coming to you and saying,
They did prepare a proposal, and that was reviewed. And Mr. McCall worked through that proposal. They came to Mr. McCall. He with them created that proposal, and then it came to this group. So that has been done. It hasn't. The process probably wasn't as clear to this group as we might see in other organizations, but that did happen.
okay. Well, moving forward, I would like to see some kind of standardized protocol that can be followed. It would just make it easier. It's like zoning, everybody's treated the same, some kind of written procedure for future. So, thank you.
Point taken. Thank you. Other comments? All right. All in favor of the request of approval for the Community Day Services proposal, say aye. Opposed? Oh, I am sorry. I'm missing that. Before we,
What percentage?
and this is
Lisa
Lisa
Thompson,
Thompson,
Project
yes.
Odds. What percentage of the funds available does this request represent?
Percentage or amount?
So, yes, either.
Can you answer that, please, for?
The amount for the request is in the packet.
Is that like 50% of the tax funds available, 80, 10?
Well, I can't provide a percentage at this time. We can give you the amount. That's within the packet, and Brian, if you want to share that, feel free.
Yeah, no, I saw that. I was just wondering if there was additional funds after these are utilized.
Ms. Taylor?
Thank you. Ms. Thompson, are you asking about our reserve or our fund balance for community projects within BHCC? So yes, we do still have reserve funds available. I believe it is over $3 million in reserves that we still have available.
Stephanie
Yes.
Barish. So my question would be, and I will completely admit to probably not reading this as closely as I should have this morning, but the funds are requested for renovation and with the intention that long-term they would allow Bridge Academy to expand, as I understand it. Will the renovations allow for any additional services to be provided to new clients or more available services in the meantime?
Mr. Whipperman, can you help answer that?
I do, yes. We currently, with this renovation, would be able to add 25 clients, probably within the first 6 months of completion of renovation into our day program, as the wait list is rather large. And then that extension of that would allow Bridge to expand into that space as we are looking to continue to grow our day program and would then look to further grow day program, but outside of our current facility because there's no space left. So yes, it would absolutely allow more client services immediately.
Thank you.
Just so I don't rush this process, any others? I'm not able to see everyone's heads, so yes.
Again, forgive me, but I kind of have a question since I represent the funder or one of the funders for this. My understanding from the intergovernmental agreement that the money, whatever the reserves are not just for the mental health part, but also for the public safety. And I do know that I've had a conversation with Cassie about, this was a while back, about the data. I don't know the alphabet soup name, but that data program that needs to be, and that you are saving for that, and that represents the reserves.
I think this conversation is not necessarily related to what's on the floor.
Well, this is where I'm going. I appreciate you saying that. Where I'm going with this is that within the intergovernmental agreement, which controls the money per se, there is nothing specific about capital expenditures. It's primarily for new and innovative programs. So again, that reflects back to my original comment about procedure and defining, what's appropriate based on the intergovernmental agreement and the plan. I'm just throwing it out there. I'm not,
And
not making any particular argument. I'm concerned there's a political component to this.
I think Bridge it's expanding programs. Bridge was a new program that came through this group. So the expansion of that program does require some capital. And so that is the thought behind allowing that the expansion has to have capital in order to expand. Okay. So that is the thought with this proposal, is to expand that program. In order for that program to expand and offer a larger population, more individuals, there has to be space. So that space then would come from that. Ms. Schaefer.
However, this isn't actually for Bridge right now. This is for lifelong access. So it's not really an expansion of Bridge. which was innovative and things like that.
And Mr. Whipperman.
Madam Chair, that's a fair question. So part of the behavioral council's plan, right, was that we supported people with developmental disabilities, and you know, I've spent a lot of time working on that. And one of the things I think is positive for this group to know, there are currently, depending on which state list you believe, 20,000 adults in the state of Illinois looking for some sort of supportive services. And our very first client through our behavioral health clinic, when we started ours 3 years ago, was actually an adult into the day program who was denied funds from the state after exiting high school at 22. So the way we see this playing out is through our BHC, our behavioral health clinic. We anticipate adding clients who have yet to access state funding as they graduate high school or other roadblocks that might be in their way. So it's a two-phased approach. Yes, it's for us initially, but the actual design of this space was done in conjunction with Bridge so that Bridge could expand when we vacate the space so we can continue to grow our day program.
Again, thank you for the questions, and thank you for those clarifications. So, other discussion? Appreciate the discussion, by the way. I don't want to shut it down. All right, seeing no other questions or comments, all in favor of the request approval for the Community Day Services proposal, say aye. Opposed? Schaefer opposed. Any other? Yes.
May the record reflect that I abstained from the vote.
Would you have one abstention? All right, very good, thank you. Now we will go to request approval of the sexual assault RFP submission, and I need that put on the floor. Need a motion. I have a motion by Ms. Hartman, a second by Ms. Thompson, and I believe that Liz German would like to speak. Is that correct? And
Do you want me up there?
yes, that's
Okay.
fine. We may need to come back and get the microphone if people have additional questions.
Throw it back and forth. So, excuse my notes because it's early. I don't want to forget anything. First of all, thank you for considering this request again. I know it came up last month, and there's been a few things that have come up since the special meeting, and I just wanted to touch on a couple pieces. One in the packet on page 16, I've added a current funding breakdown so you all can get a sense of the decrease in VOCA funding. That was about $300,000, and then the additional grants we did get, but that's still putting us at a deficit of about $145,000 based on last year's funding. And so I thought it would be helpful to see the amount of federal and state grants we're already getting and where that decrease came from, hence where the waiting list emerged and where the request came from. I also just wanted to point out a couple things that might have gotten lost since we presented so long ago in September. We do obviously serve ongoing clients, counseling, advocacy, we do prevention education, but we also have a crisis component to our program. And so last fiscal year, we served 355 non-clients in crisis. And so just to make sure that you all know that we are also actively doing crisis work in addition to those counseling and advocacy numbers that you see. In addition, our counselors, in case this wasn't spelled out, they have specialized training in sexual violence. And so in the first year of counseling, not only do they come with their own educational backgrounds, but they're getting over 100 hours in specialized training on dealing with clients with sexual violence in their history. And then ongoing from that, there's continuing ed every year. So it is a very specialized area in terms of counseling. Yes, there are wonderful counselors out there, but specifically this is what our counselors are trained to do and trained to stay on top of any of the newer treatments or ways to treat patients, whether it be EMDR or animal therapy, play therapy, all of the things that might come out that might be new ways to tackle that topic. I think that's all. I just wanted to throw those few things out there and then answer any questions anybody had. I also have Jen Galladay, our Director of Stepping Stones, here if anybody has any specific program questions that I might not be able to answer. So thank you.
All right, any questions or discussion that needs to? Mr. McCarthy's coming forward.
I needed extra steps this morning. Thank you. And thank you. Mine's more procedural in nature. I'll start off saying I'm supportive. Before anybody wonders where I am on this issue, I'm supportive of it. But procedurally, can you help us understand why we're voting again on this and really what's going on in the background, and more of a procedural question like my colleague Ms. Bolin had on moving this forward, and is this the ultimate decider of these proposals, or is it the executive committee, or our understanding was that this body was the decider of these type of issues, but maybe you can help us and shed some lights on that. Thank you.
You want me to take? So this is an advisory committee, so they will send this forward to the executive committee of the county board. The county board executive committee will up or down on that, and should that continue to go forward at the executive committee, it will be presented to the board. And then next Thursday, should it make it to the board, it would be voted at that board. The reason that there is there was a delay, there was a procedural error that was made, indicating that people were unable to comment or vote, and due to some online. And so we have, that was in error, and we felt we needed to take a step back and be clear and clarify that, and then move forward. So that was the reason for that. Anything else?
I very much appreciate the question because this was unusual from last special meeting to this meeting. I'd like to add to what Chair Metzger said to indicate that the Behavioral Health Coordinating Council, as an advisory that was created by the McLean County Board, is in part, their mission is to help promote and create programming for all the citizens of McLean County in areas of mental health. And to that end, the guiding document that we have been using is our Mental Health Action Plan. That Mental Health Action Plan has 54 different recommendations. With regard to funding, one of our funding streams is our shared sales tax that is generously provided by the town and the city through an intergovernmental agreement. And so when issues come up that have a funding component, this body is asked to make a recommendation that then goes through the executive committee and the county board as described by Chair Metzger. But that is separate and in part from the total mission of BHCC. And so I just want to make clear that shared sales tax is not synonymous with BHCC. And so the recommendations that come up through county board have a twofold purpose. One is to make sure that the programs and projects that are presented to this committee meet with the recommendations of our Mental Health Action Plan first and foremost, and then if there is a funding component, that we find those funds, whether they be grant funds, shared sales tax funds, or county funds. And so with this project, it would be utilizing shared sales tax funds, and that will go to county board for approval. Hope that explains it.
Very well. So part two would be, I'll put you on the hot seat a little here. If there's a conflict between the recommendation of this board and the county executive committee, what happens?
If there's a conflict between this advisory group and it goes to the executive committee and county board and it is voted down, the county board has the final say.
Thank you.
Yes.
Yeah, I have a question or clarification, actually. In the packet, it seems that the request is to replace a federally funded position. Is that correct?
So it's to preserve services that we have right now that we had last fiscal year that we have lost. So because of that decrease that is temporary, we are having a waiting list of clients and unable to see all the clients that we need to see. So it is because of a funding issue that we're coming to you for these dollars, but we don't expect this to be an ongoing replacement of funds. We know that VOCA, this was an extreme situation. VOCA has never been cut in the history of years upon years upon years, and they're hoping to stabilize VOCA. So then our next grant cycle, we'll be able to get some of those funds back.
Okay. But there's no guarantee.
Well, yeah, there's
Okay.
never any guarantee
Well,
with those dollars.
the reason
but-
I'm saying that is that probably everybody at this table, the city, the county, are all, asking for money from the federal and state government. So I understand, and thank you for the answer. I'm struggling with this, again, as a funder, because it is local tax dollars that are going to be used to replace the loss of federal or state funding. And in my opinion, if this was, again, at the council, I would probably say no, because it's not the appropriate use of local tax dollars. So I really cannot support this.
Can I make a comment?
Yes.
Okay. I just wanted to say that while the federal funding that is being asked to be replaced may be federal, the folks that are being serviced by these programs, the 60-plus individuals.
I think your position, we should not,
I'm just
we
trying
need
to clarify. Okay, thank you.
Ms. Schaefer.
Thank you, Madam Chairman. I'm going to preface this, and I want to be very clear that what I'm going to say is not anything to do with the YWCA or Stepping Stones, okay? Take that whole thing out of this picture, because I believe this is a much broader conversation, and we could say XYZ, agency and, program A, and that's much broader, and it kind of is what Member Bolin is talking about. I've had some of these hard conversations with other providers in the community. Some of them are in this room, some of them are not in this room, about this very topic. I'm not the only one that's had those conversations. Previous administrators have had those conversations. Previous chairmen of the board have had those conversations with individuals. They're kind of hard conversations. If you go back and think about some of the things that have happened in the last 5, 6, 7 years, that we had a budget impasse. The state wasn't paying for anybody. So what did providers do? They laid off people. They stopped programs. United Way changed how they funded providers in the community. They would give capacity grants. And so what did those providers do? Because this is some of the times that I've heard some of these things. How do we make up this money? So a lot of them just cut programs, cut back on services. We had a pandemic. What happened there? Providers cut back on services because they didn't have money, okay? The practice is, and many of the agencies and providers, not just in McLean County, the county government, throughout the country, because I was actually on a webinar last week that actually somebody said this, is the grant went away, so we had to cut back on services. That doesn't stop the needs on any of these. So where is the end of this? Who is going to be the next person coming in and the line? Because I could probably name a whole bunch of them that had grants that have been ended, that have had cuts from the federal government or the state government or whatever. Who knows what's going to happen with the state with some of the things that they're talking about with this next budget on providing funds and changing the way they fund things. So I'm struggling with this because, like I said, the line's going to be out the door for our next meeting. And is this what we want? Is this basically going back to what we were doing before we want change? Is this what we want to tell the community? We're just going to keep funding things just because somebody cut their grant, or, the feds cut their grant, the state cut their grant, the grant ended. The first question that at a county board, when we have a grant that comes before us, a new grant that comes before us, we say, so what happens when the grant goes away? And the answer is always that people go away. That doesn't mean the need or the program isn't bad or isn't good. It's just that that's the way reality is. And, that's why I'm saying that this has got nothing, it's a broader than this particular instance. It's just bringing it to the forefront that had a lot of these conversations had been going on in private for many years. So, and actually in the Mental Health Action Plan, nowhere does it say we're going to make things whole, make agencies whole. Because if we did, we would have spent tons of money years ago and we would have not changed anything again. And so, some of this actually kind of plays into why I voted no on the one for we just had, is the same concept, is that where does this stop? How do you get in line? I've had people come to me and say, how do I get in line when they've seen this? So I guess that's why right now I can't support this, because I don't think that this is what the community is expecting us to do. I think the community, and if that's what we end up doing, then we're telling the community we're just kind of going to do the same old status quo that we were doing back in 2013 when all of this started. So, thank you.
Ms. Bowen?
Yeah, I have one question. The county has that RISE program, which is, I believe, to address trauma. At least that's what it says on the website. Is there any way that the YWCA and the RISE program could coordinate for certain aspects?
Yeah, the RISE program, which stands for Resilience, Inspires, and Spreads Everywhere, is meant for a trauma to build a trauma-informed community, and that's a little bit wider spread than providing direct sexual assault crisis services. And so, while yes, there's always an opportunity for any of the organizations in our community to become further trauma-informed and to help our community become further trauma-informed, I wouldn't say that the partnership is necessarily what I think you may be describing.
Okay. Well, again, in the packet, it says something about education. That's part of their need and expenditure. So I was just thinking that the coordination with the education part from the RISE might be a good partnership, because I'm very supportive of collaboration, because when you start with silos, you end up with individuals coming for special requests. So
Sure.
That's all. Thank you.
Okay, thank you.
Mr. Bolenhouse?
Thank you, Chairman. Thank you, Chairwoman. Just, by the way, I do have an appreciation for Ms. Schaefer's comments as a provider. It's definitely our world. From a clarification standpoint, my understanding of this funding on sexual assault services is that it started with a NOFO that was issued in December and was not the result of just the Y coming in and asking for money. Is that not the case?
It is.
Ms. Hartman?
I appreciate the comments that have been made. From a member standpoint, I guess my thought is that we came together at the request of the county because we are providers with very deep knowledge about the behavioral health needs of the community. And because of that, you or the county wanted our input into what we feel are the most important needs that need to be met within the county. And so I guess my opinion is that I'm not separating those between new needs and old needs, or new programs and old programs. I get the fact that it'll open the door for people to come. And I think that as an advisory committee, then our stance should be, how important do we feel this is for the community? And if we feel like this is a critical need in the community that needs to be sustained, I'm using need a lot, I apologize for that, then we have the right to say so, and to vote on that and to move it forward. So I'm just sharing my opinion.
Other comments or questions? Yes.
Our table needs a mic. First of all, I have a couple of different points, and my first one is in absolutely no way a reflection of the wire stepping stones. But I did want to echo the comment made earlier that this process has kind of felt like the cart is before the horse. Like there's not a conversation about needs and then a determination about where that funding could go, but somebody comes with a need and then we're talking about funding. And so to me, this felt a little rushed. So I would just echo that request that there's some kind of procedure or structure set up around those things. In terms of the why, I have a couple of questions for you, Liz. First of all, I recognize the need. I've been in that boat. 2 questions. How many individuals do you believe that this funding would allow you to serve, right? And number 2, what other ways to obtain or find or broaden your funding streams have you taken?
So I am going to look at Jen when I answer this, because basically what we're talking about is a caseload and a half in terms of these dollars, and so that would be X number of people, Jen?
Could you please come to the microphone? Thank you.
Okay, so for a counselor and a half, that would be about 30 ongoing clients that we'd be seeing. That counselor and the half counselor would also be serving on the 24-hour crisis hotline and providing medical advocacy on call as needed. So that's a hard estimate. I would say we see about 355 people in the crisis line annually. We have 12 staff, so I can't do math on the spot. It would be quite a few individuals between our ongoing clients and then the crisis hotline and the hospital calls. I would say probably 100.
Thank you, Jen. And then in terms of other funding, so we have written for John M. Scott funding in the past. I know that was something that came up. We were ineligible for that funding due to the fact that we cannot restrict who accesses our services. So we cannot guarantee that all of our clients will be low income. And so it goes against the language of the trust. We were invited to apply, and then unfortunately they said we would love to give you this money, but we can't. We do have a grant request out there to Second Presbyterian. On the funding sheet that I included, there are 2 new grants that we have received during this fiscal year. So the SASP grant is new and the Social Services Block grant is new. And the other thing I just think is worth mentioning is that sometimes the way that our center is set up as a certified rape crisis center, just like in the case of John M. Scott, it does kind of create barriers because there's certain demographic information we cannot collect. There's certain, we can't serve just a certain population. We have to be open to everybody as people would want us to be. So we fall into sometimes a category where people don't know how to fund us. And one of the reasons that we rely so much on federal and state funding is because they do understand rape crisis centers and they distribute it to all of the centers in the counties across the state of Illinois in that way. So the funding is a little complicated, but we are actively seeking grants all the time, as I'm sure you are too.
One more follow-up. Does something about your status as a rape crisis center preclude you from being able to bill funders like an insurance company or Medicaid or an MCO?
Yeah, so it's a little challenging. When we have looked into it in the past, we were not able to bill Medicaid for the majority of our services. In very few situations could we, to the point where it was not worth the administrative burden to do so. I have been looking into, has that changed? Is there different opportunities? However, the advocacy piece of what we do cannot be billed, and so the education piece cannot be billed. So there's always going to be an element of things that we can't bill for. The other thing to note is that with our level of confidentiality as a rape crisis center, that also means that we have basically attorney-client-like confidentiality. And so if we have somebody who's getting counseling from another agency and getting advocacy, that creates an issue with confidentiality. It can break confidentiality, and it actually can hurt the victim when they go to court. It can enable them to, we can't keep all of their records confidential. And in order for us to communicate with a counselor that's outside of stepping stones, it also breaks that confidentiality, which opens up a whole can of worms. So there is a reason why rape crisis centers have counseling and advocacy built together, even though it does complicate things when it comes to like the billing side.
Thank you. And I know there's another question back here.
Mr. McCarthy.
Try not to break this thing. Here we go. Thank you again for the clarifications. Procedurally, first, I greatly appreciate the questions in this conversation and it happening in this forum. A public conversation about our process and what we're doing is important for clarity, for fairness, for all of the things that have been talked about already. And out in the public is good. It's good for our community to see and know all the time. Unfortunately, that's happening while the YMCA or YWCA is in front of us. Apologies for that. This seems to be bringing a lot of these issues to the forefront. So I think we have some conversations to do as a group about our process. I do appreciate and want to reflect Ms. Hartman's comments about not discriminating between existing needs and new needs. When this idea was originally pitched to us at the Normal Town Council, we were talking about expanding and more effectively meeting the needs of and starting to try to identify the total amount of need in our community. I know we've made some progress on that. And from my perspective and some of the conversations in my council, if we're constantly focusing this funding on new while existing is eroding, are we really effectively expanding and more effectively treating this community? I think we have to do both. I agree with the comment that I believe that this board was supposed to be the arbiter of those spend dollars. Process and procedural comments aside, I think we have some discussions to do on that as well. But I believe that was part of the mission. I think this also underscores a broader concept. What is the standard in which we're measuring and being the arbiters? And that was positioned with us that the Mental Health Action Plan was going to be the standard and present to us the statement of priorities and values of where we spend our dollars and on what and which. And so for me, those are the processes I use when I look at these type of proposals. The third comment is, for a long time in this board, we didn't see proposals coming here and we weren't spending money. That was concerning to the town of Normal, frankly, as a funding partner, that money was coming here and it wasn't going anywhere. So all due respect, I hope people keep coming and getting in line and that they keep asking, because that's why we put money in this initiative, is so we could fund things and expand services. I hope that we all adopt that perspective that that's why these funds are here. Now, how we decide and whether we all agree or disagree, we'll sort that out in votes and presentations and some process and procedure. But I just wanted to share out that I hope we do continue to grow providers that are looking for new and one-time funding to shore up. I think I agree with the perspective that we're not here to be stopgaps for other levels of government that are changing their amounts or priorities or what's available. That wasn't the point of this, certainly. But offering some stopgap one-time funding, I think, is certainly so we preserve and hopefully expand some services, new services, to be available. So I just wanted to offer that different perspective that more people coming to ask, I think, is a good thing. Thank you.
Any other comments from the floor? Ms. Taylor, you want to clarify?
Yes, so this is not about the action item that's on the floor, but I do want to point out that within internal conversations with Chair Metzger and staff, we have identified that as robust of a document as the Mental Health Action Plan is, it doesn't very well speak to strategic priorities. And so when we're looking year to year about what our focus is supposed to be with this group and how we're supposed to lead dynamic change in our community, that's where we're kind of missing the boat. And so I wholeheartedly agree with past conversations I've had with Chair Metzger as well as other members of BHCC that we can do better. And I think process is part of that, and also defining our strategic priorities. If our first attempt at that was the work groups that Kevin McCall has been designing for all of you to kind of hone in on those priorities. But it seems like that process has also missed the boat a little bit. And so I think coming back to the table and looking at that anew will be good. And again, that is separate and apart from this action item that we're talking about today.
Yes, Ms. Adams.
I am not a behavioral health professional, but certainly appreciate what everyone is doing in this room. But I just wanted to comment on the perspective and Cassie, a little bit of what you said. And in a large organization, yes, this is a budget conversation. And to your point is there a process in place for these types of requests? Because I do agree. I think the community does want us to continue to receive requests. What we do from a large corporation standpoint, and it's usually in regards to IT dollars, and at times can be the Hunger Games at a company. So what we tend to do is to align a certain amount of that budget to those strategic initiatives that everybody knows is the North Star. But we also then carve out part of that budget for discretionary dollars, which then allows the business to come in with a business case and a CBA to then get some of those dollars. Because we all know everybody's project is important to the organization, but at the end of the day, there's only a certain amount of money. So it sounds like this is very similar in that case. So I would agree that some procedures and maybe looking at that budget would be helpful for the group. So thank you.
Just so you're aware, the McLean County Board has about $500,000 set aside for discretionary. All right.
That is wonderful. Thank you.
Thank you for your insights. Again, this is the third meeting that I have chaired, and this is the best meeting we've had because of the conversation between all of the people and the questions that have been brought forward. So I want to again thank you all for those comments and for contributing. And Ms. Hartman.
Thank you for that. I wanted to just point out that to reiterate what Matt had said is that we put out a NOFO, and the YWCA responded to the NOFO, was the only respondent to the NOFO. And so I think our conversation is very important, but I also think that we need to go back to the thing at hand, which is we have a NOFO, we have a respondent, and we should vote on whether or not our sole respondent, and we didn't say in the NOFO that people who already are doing the service could not apply. So technically, I don't know that any of the discussion that we've had pertains necessarily to this particular NOFO.
Point well taken. I need to step aside for just a moment. And I have to, this took place prior to me being chair, and I did not attend the meeting where there was the no vote. However, I think we have a motion on the floor. We have a second. And I think we probably need to proceed with that, but Ms. Schaefer would like to also make a comment.
Yeah, and I guess this goes back to process and actually questioning the process that this actually happened. Because back in September, Liz and Jen came to BHCC. Like I said, this is before Chair Metzger was chairing BHCC, and talked about the need here. And then there was a NOFO. Now, I went to the December meeting or January meeting where I didn't get the impression that this group said, yes, let's put out a NOFO for this because we think that this is a priority. That's kind of, and so, I mean, it's like when we do things at the county level, if some department wants to get something and they put out a NOFO for it, but they come to the oversight committee to say, yeah, we want to do this, and then they come back with the results of the NOFO, if the oversight committee does that. So I guess this is process, this is procedure, is this really, that's why I think I'm struggling with that too. It's all part of it. It's a very much broader issue than the why. That's why I said it's not about the YWCA and the program at all. It's a much bigger issue, and maybe we don't go anywhere with this right now because of that. Because we need to make sure we have a good process with this. I'm just saying that we've heard a lot of process and concerns and stuff like that. And yes, we have a NOFO and things like that. But I wasn't here last month. I was on vacation, so I couldn't say any of this last month. Thank you.
There is the opportunity to vote no again for those who voted no before, so I will remind that. Ms. Hartman?
I just want to say that if we're going to not follow through with this process, then I think we need to go back and revisit the process and the vote that we took prior to this. And no offense to you, Brian, but we can't now at the end of this go back and say, okay, we're going to change everything entirely just for this one NOFO that's already been put out. I think that going forward, we need to define the process, and I'm in complete agreement with Susan on that. But I think for this particular case, we had a meeting. Nobody questioned the NOFO in the last meeting, which is where it should have occurred. And so I think we need to it's my opinion that we need to carry through on the vote.
Any other comments? Yes, Ms. Thompson.
I was just going to say that we did send a NOFO out. They are responding to that. I feel like we've brought them through 2 meetings now, and the people on the wait list are people in our community, and so I feel like we need to move forward with that and not hold them hostage because of our processes. We can address those in the future, but I hate to bring them back a third time because there's critical services that need to take place, and I can appreciate that you're leveraging $800,000 from another funder, and I think it's completely appropriate that our community has skin in the game as well at the $50,000 level.
I don't want to stop any additional conversation. So anything else from any of the parties? Do we have anything online? Anyone? Seeing nothing more. All in favor of? All in favor of the request approval of a sexual assault RFP submission, say aye.
Aye.
Opposed? We have 1, 2. We have Schaefer and Bolin. That motion passes. As Mr. McCarthy had clarified, it will go to exec on Monday. Should it pass exec, it will go to county board on Thursday. Thank you very much. Thank you. Thank you. We're moving to number 4, and we have community updates, and we will start with Tony Jones, and that's grant opportunities and collaboration.
Thank you, everyone. I'm just actually going to provide more or less a FYI about a new resource that we'll be providing, which is a grants, we just talked about funding, a grants newsletter. And this is something that's going to be launched later today. The audience for this is going to be the Human Services Council, as well as our other additional business partners within the community. And also, I just wanted to share for reference, on the table, right next to the right next to the package, there is a handout that you'll be able to revisit the information I'm about to talk about. But the grant newsletter is something that's, I would kind of describe as a Reader's Digest of grant funding opportunities for those organizations that we partner with. And also it's a way of conveniently communicating those opportunities to them. So we will be providing them those grant opportunities that we anticipate that may be of interest to them. But as a companion to the newsletter, we also have a questionnaire which actually provides them the opportunity to provide information about what types of grant funding opportunities are of interest to them, as well as information that we can follow, contact information so that we can follow up with them. So in the future, after the first newsletter, we'll be able to tailor the information to it so that it's relevant and beneficial to them. Because as I indicated, it's somewhat like a Reader's Digest of grants that we're providing to them. And also, I just wanted to, and I jotted down a few notes here, so far as and I just kind of reflect on the conversations that was just had here in regards to, the benefit and the relevance of providing this type of information to our community partners in regards to funding opportunities. For instance, whenever there's a shortfall, they have awareness of additional opportunities on a federal, state, and as well as other levels in regards to what they could pursue. Also, the newsletter is going to provide some resources for them, provide them hints and tips in regards to being successful with applying for the grants that they are going to pursue. And this is something, an additional thing that's brand new to Kevin, because I had one of my peers do a review of my draft of the newsletter, and that drifted off into a conversation in which for all of the grant coordinators in the area, basically to do some collaborations among ourselves, perhaps having a quarterly meeting in which we're basically talking about ways that we can allow ourselves to be leveraged by community organizations so that they can also be more successful, as well as so that we can actually somewhat tag team so far as identifying opportunities for grants. So that's just, like I indicated, just more or less a FYI. I didn't want to take up a lot of time, but definitely I'll hang around afterwards, or even if you have questions now, I'll entertain those. That concludes me.
Thank you. Does anyone want to ask questions or make comments that Mr. Jones can address? Thank you so much. We will move to Kevin McCall, Behavioral Health Coordination.
Thank you, everyone. I'll keep it brief as well. We intended to have a 2023 comprehensive overview today in addition to the mental health action plan presentation we had in December in our last quarterly meeting. In further review, it was determined a few changes still needed to be made to that document, some of it, based on those discussions that we've had today, but also to make sure that we had the most up-to-date information for our BHCC members, the most comprehensive information that we have. And so there will be a report coming soon, but a few changes needed to be made to that, and we look forward to sending that out to you all for some further review.
Now we will have open updates from BHCC members. Yes, Ms. Foley, or I should say Honorable Foley.
Good morning, thank you. I just wanted to give an update from the Circuit Court on our progress with Family Treatment Court. As a refresher, Family Treatment Court is a drug court program for parents who are involved in the child welfare courtroom. So the abuse and neglect where the children are at risk of being removed from their homes or temporarily are already removed from their homes. We have hired a coordinator. Her name is Caitlin Stigl. She started with us at the end of January. We are working on finalizing our documents, so to speak, our MOU, our policy and procedure, all of kind of the entry paperwork that you would think of with these types of programs. We are finalizing things with DCFS. They're in a lot of transition right now as a state agency. Having developed a different problem-solving court without a state agency, it's very hard to work through a state agency, but we're making progress. We have a mentor court in Grant County, Indiana. We're going to go visit them again in early April, and it's my hope we can start accepting clients shortly after that. So Carl Broman is our treatment partner. We're also partnering with Babyfold and CYFS within the community, so we're really looking forward to getting this off the ground. If you have any questions, let me know.
Questions for Judge Foley? Thank you. I know that is an ongoing challenge, so thank you for taking that challenge for our families within our county. So appreciate that. Other, yes, Carl, Ms. McLaughlin.
Yes, thank you. Good morning. So I'm relatively new to this group, and I will keep my comments brief. But one of the things coming in is I wanted to become more aware of the process and learning from all of you of how this group functions. And then I realized through the discussion that maybe the whole group is also learning and working through things. So I didn't want to bring it up during the conversation, and we had good things, but I just would request as a member at the next meeting if we could have some budget guidance in terms of what funds are available for this year, what are the discretionary versus the initiatives, and maybe that's not hammered out, but I don't even know how much as a board member we're expected to kind of look at and vote on in a calendar year. So that would just be a request coming next time. I think most of us in this room are very familiar with the action plan and with the priorities and things that are in there, and we can talk about them in our sleep. But what's the funding, and then how can we prioritize as members and as a group? So just a request for June's meeting.
Thank you. Anyone else? All right. I do have one topic. As you know, this current Behavioral Health Coordinating Council, you, as members, you are a very important and knowledgeable mental health resources to McLean County. And you have shown that today, and you are, we greatly appreciate all the time and energy that people spend preparing and having discussions outside this and then meeting with small groups. But the Behavioral Health Coordinating Council was created in 2016 with a mission to improve the behavioral health of McLean County residents and create systemic change through innovative programming and strategies. That was our mission. However, the Behavioral Health Coordinating Council structure is not meeting this mission. McLean County needs to reset, refocus, and restart. Because of this, I will not continue this meeting until further notice. Programming, however, will continue. That will not change. Further communications will be coming directly from me. As we've all identified, we need to look at structure, strategy, objectives, processes, and procedures. We will work through that and reconvene. Thank you. That ends this meeting, and we are adjourned.